to talk about a diabetic patient, and this is the reason why with diabetes, it's just we want to keep close attention. So the diabetic patients, we usually want to keep close attention to our feet, which this lovely patient here did because she was busy on the weekend and she bumped her toe and noticed that there was something hurting. This was what, 2 days ago?
Mm-hmm.
Okay.
Or 3. I don't remember if it was Thursday or Friday.
Okay.
I think it probably happened Thursday.
Okay.
But I didn't know. It wasn't hurting until Friday.
So when did it start changing color like this?
Yesterday.
Yes.
Yesterday, last night.
Okay.
And it's gotten bigger. It was not.
As
and
big.
it was 2. It was
And now,
2.
oh, I see it. It was right here and then right here. Now they've
Yes.
formed into one. Okay.
Yes.
So she went to the emergency room and then they took an x-ray and gave her antibiotics. I didn't have access to those x-rays, so I did take one here. I didn't see anything affecting the bone. And the thing that you did that was really good is it happened Thursday or Friday and you went immediately and got help. So that if I open this and when I open this, if there's pus or anything, the likelihood that it's gone down to the bone is usually less. It's probably still in the tissues. You're going to have a wound that we're going to have to care for now. Okay, so I'm going to clean this up really nicely and I'm going to lance it and take all of this black dead skin. If it was just a blister, I might just pop it and leave it on, but this is a hematoma, so you have like blood in there, maybe even pus, and we need to clean it out so that infection doesn't, get any worse. Okay, you can even see it's kind of getting red here a little bit. So
and it was red further down. It was red going all the way down here.
Oh, so the good thing is that they started you on antibiotics, and at least that'll help. Let me go get the stuff I'm going to use.
Okay, am I good?
Yeah, the pain that you're feeling right now, you're not going to feel much more than it. And I'm going to test you to see if you have some sort of neuropathy.
I do.
Okay. Well, see, so the thing is, if sometimes people have neuropathy, but they have sensation on certain parts of the foot. Yeah. Okay? All right. Usually I'll culture this, but you've been on antibiotics for a few hours now. Mm-hmm. Ooh, see that? Look at all that ooey gooey goodness.
What is that?
It's just blood.
What makes it do that?
You hit it.
Oh.
When you hit it, you had trauma to the area, and that made it bleed. I'm sorry. Okay. Let's use the Okay, let's take a break. Let's see. Anything? Okay, good.
It's not hurting where you're cutting. It's not hurting where you're cutting. It's hurting down here.
Down here?
Oh, once I put it down on something, it usually stops it. Do I need to put my other foot back up?
No, you're fine. Okay? You're fine as long as you're comfortable. It's okay. That's fine.
If that hadn't been punctured, what would have happened?
It could turn into an infection.
To gangrene?
Yeah. It could turn into wet gangrene. It could turn into dry gangrene. It could also turn into just a wound with pus and all that. At this point, all we have right here is just blood, which is good. Oh, no, you're fine right here. Yeah. There's blood, so that's actually good. It could be much worse. All right, I'm going to wipe it down, okay? I'm sorry. This is a good teaching point.
Do you teach?
I host a free once a month diabetic educational class in the office, because a lot of people who are diabetic do not know how bad things can get without proper wound care. And so my way of, I suppose you could say, giving back is kind of educating the community about things that could happen, and I don't want people to lose their foot and things of that nature. All right, I'm gonna wipe down, okay? So it's actually not too bad. As long as you keep a healthy diet and your A1C is well controlled, which by the, our conversation, it was, I think you should, your potential for healing is very high. So you have that working for you. Okay. I expect that this should heal really beautifully by the next time you come.
I have to change the dressing.
1.8. You can change it in about 2 days. Okay.
Is that something different?
Yeah, so that is Aquacel. It has silver in it, and what silver does is it helps to fight off bacteria. But once we have that, after a few days, that's fine. You can change it. You can actually, as long as you're not draining, Aquacel is actually good for about a week.
Oh.
As long as you don't get it wet or anything of that nature. Okay. Perfect little tape.
How long have you been doing this?
About 4 years. 4? No,
Why did you
3,
go-
4, 5,
Why
5.
did you specialize in feet?
I like the versatility of it. I can do wounds, or I can work on fractures or traumas, or I can do reconstruction. And if I wanted to just beautify the feet, like for bunions and hammer toes, I could do that too. So I like the diversity of it. I'm able to do more than one thing. Okay.